Suicidal and violent risky assessment are among the most critical responsibility of a psychiatric clinician. Every psychiatric evaluation requires the ability to identify, evaluate, and manage risks. Risks, you want to assess the suicidal attempt, suicidal risk, non-suicidal and self-injury, homicidal behavior, violence toward others, self-neglect, risky associated with psychosis, mania, intoxication, severe emotional dysregulation. Psychiatric clinicians must be able to answer is the patient at risk of harming themselves or the others? How immediate is the risk? What factors increase or decrease the risk? What interventions are necessary to maintain safety? Risk assessment is not prediction tool. No clinicians can predict with certainty whether the patient will attempt suicide or commit violence. Instead, risk assessment is a structural clinical process used to estimate risk and identify modifiability factors and develop appropriate interventions. So principle of a psychiatric risk assessment include the purpose of the risk assessment. The purpose of the risk assessment, the goal are to identify current danger, determine severity and immediately of the risk, identify protective factors, reduce modifiable risk factors, and create safety plan and determine level of care. Suicidal episodic and clinical important. Suicidal is a major public concern associated with mood disorders, psychiatric disorder, substance usage, personality disorder, chronic illness. The highest psychiatric risk conditions include major depression disorder, bipolar disorder, schizophrenia spectrum disorder, alcohol and substance usage disorder, borderline personality disorder. The psychiatric clinician's approach to suicidal ideation is to assess the direct compassion, non-judgmental, specific compassion, non-judgmental, compassionate, non-judgmental, specific, thoughtful, and ask about suicidal does not increase the risk of suicidal risk. Suicidal assessment framework. Comprehensive suicidal assessment evaluation. You want to evaluate the status, intent, plan, access to mean, preparation behavior, previous attempt, currently psychiatric symptoms, substance usage, clinical judgment. Suicidal ideation assessment passive ideation. You want to assess if there's a passive ideation or active ideation. You want to assess the intent, assess the plan, the method, the time, the location, the preparation. You want to assess the means. You want to assess if there's a previous attempt. You want to assess non-suicidal but injuries. Risk factors, biological risk factors include the family, psychiatric illness, family history, psychiatric illness, chronic planning, neurological illness, sleep disturbance, psychiatric risk factors such as depression if the patient have a depression, if they have a bipolar disorder, if they are in psychosis disorder, if they are using substance usage disorder. Psychological risk factors include the symptoms that they tell you, if they are hopeless, feeling trapped. Social risk factors, if they are isolated, relationship loss, financial stress, legal problems, house instability. You want to assess the protective factors that helps the patient to cope whatever stress they are on. Include if the internal protective factors include if they are a hope, if they have coping skills, if they have problem solving ability and future goals, and you want to build those. You want to create and guide how they can hope, you want to also teach them coping skills. You want to teach them problem solving ability. You want to set up goals for them. External protective factors include family support, treatment engagement, employment, religion and occupational beliefs, access to health care and mental health. Suicidal risk formation, you want to assess the acuity, chronic, protective factors, clinical judgment, if they have final assessment. You want to assess the tools, you want to assess the comorbidity, you want to use the scaling Columbia Suicidal Severity Rating Scale. You want to also use, if they are depressed, you want to use the PHQ-9 to screen depression. You want to also use the ASCII suicidal screening question tools. Safety and planning interventions. What include safety planning interventions? Safety planning is the evidence-based interventions. Safety plan include 6 steps. Step 1, you want to recognize the warning signs. Increase warning signs. What are the warning signs? They are increased hopelessness, withdrawal, substance usage, increased substance usage. So you want to recognize the warning signs. Then you want to identify internal coping strategy. Do the patient has a coping strategy like exercise, meditation, pray, if they pray, distraction activity like games, going to social activities. You want to also assess the social distraction. So the social distraction include, you want to identify the friends, family, public places that they can go so they can distract themselves. You want to also contact the support people. You want to list the names if they feel in that way. Do you have a names that you can contact with? Phone is their phone number, available support is. You want to find out with them and encourage them to have that access. Professional resources include psychiatric providers, crisis service, emergency service. You want to provide that for the patient and encourage them and show them. Restricted access to means. You want to restrict access to means. You want to secure the firearms. You want to limit medication. Mostly they have to be inpatient. If they are feeling that way and they are risky to themselves or others, they have to be in hospital setting or locked unit to monitor their safety. Psychiatric hospitalization decisions. What are the decisions? How you can make the psychiatric hospitalization is considered when the patient is having high risk suicidal ideation, when they are having high violent risk, and they say they are specific, they have a menace, they have attentive, they escalating behavior. So that time they have to be in hospitalized. When you want to assess the violent risk assessment evaluate the risk of a harm toward others. Violent risk factors include historical factors, previous violent childhood conduct problem, criminal history. Clinical factors include psychiatric, psychosis traits. Are they manic? Are they intoxicated? Are they having a severe personal pathology? Are they in a psychosis? Situational factors include relationship conflict. Are they fighting with somebody that they have a relationship with? Do they have access to means? Do they have recent losses? You want to also assess the homicidal ideation. You want to ask this question, have you had thoughts about harming someone? Who is the target? What is the intent? What is the plan? What is the means? What time? What motivates you to hurt this person? You want to ask those questions and you want to assess. Do you need to protect and warn others? Psychiatric clinicians must understand the legal responsibility regarding threat toward identifying the individuals. Important principles include assess a serious of the threat, determine immediately, follow applicable state law, document the clinical reasoning. Documentation of a risk assessment. Professional risk assessment notes include patient report, clinical finding, risk factors, protective factors, clinical decisions that you made, specific populations. For teenagers, you want to assess if somebody is bullying them, if they have an academic stress, if they have a social media exposure, family conflict, if they are harming themselves, if they are older adult. Risk factors to assess is the relevant medical illness, isolation, loss of independence. If they are veterans, You want to assess the drama, exposure, barrel experience, fire access, substance usage. If they are parents with psychosis, you want to assess the command hallucination, persecution beliefs, impulsive, medication compliant. So never document only. Deny suicidal ideation. You don't want to just document that. Document the complete assessment. Complete assessment of the suicidal and violent risks. Risk assessment is a dynamic. Risk changes with mood, substance, life events, treatment response. Clinician relationship with the patient involves disclosure of suicidal thoughts. The presence of a psychiatric thoughts does not automatically require hospitalization. This decision is dependent on the intent, plan, mean, protective factors, and ability to maintain safety. So our questions are: what is the strongest predictor of a future suicidal ideation attempt? Previous attempt. Previous attempt is the most predictable. What are the essential components of suicidal assessment? You want to assess the ideation, intent, plan, mean, previous behavior, protective factors. What intervention has the strongest evidence for reduction suicidal ideation after the psychiatric assessment? Safety planning interventions reduce the suicidal ideation risk. Safety planning interventions. What psychiatric symptoms require urgent suicidal risk evaluation? Command hallucination instructing the patient to harm themselves. What factors increase the violence? The factors that increase the violence include previously violence, current threats, access to means, substance intoxication, severe psychiatric symptoms. Suicidal and violent assessment is the fundamental component of an advanced psychiatric practice that include structural, clinical interventions, diagnosis, knowledge, risk formation, safety planning, evidence-based interventions, ethical and legal responsibility. Effective risk assessment is not simply identifying the danger. It is understanding the suffering, reducing the modifiable risks, strengthening protective factors, and creating pathway recovery. Thank you for joining me today. Please subscribe and join me again. Thank you.